So regarding the technique, the textbooks and the literature speaks about two techniques, the static versus the dynamic. So the static is mainly, and this is the most common technique that the point of care LP is being used, is that we just use our ultrasound just to mark the landmarks that we need for our poke, and then after we're going to finish that, we're going to put our ultrasound machine aside and just do the LP like we used to, but we'll have like the marks that we did. And the dynamic approach, which again we're going to speak a little bit about it, is when we actually use the ultrasound machine while we are visualizing, like when we are visualizing the needle going in. And like I said before, for that, like we need like to sterilize our probe, because it's going to be in our sterile field while we're doing the procedure. So how are we going to do the static technique? So that's a riddle a little bit for you. Mark, maybe you can understand. So step one, all right, we need to palpate the posterior superior iliac crest, which is the level of L4. Step two, we need to mark it, all right? Yeah, I was getting bored, you know, when I prepared the presentation. Step three, we need to put our probe like in the long plane, like on our mark, all right, and to slide, try to see, find our anatomy. Then we can also appreciate the depth that we need. After we do that, we can center the probe, all right, on the desired space and mark it again on both sides. And then we just need to rotate our probe 90 degrees to the transverse plane and mark it again, and it will look like that, right? So like palpate like the posterior iliac spine, mark it around L4, even like paramedian, as you can see. And then we're going to put our probe on the long view, right? After we located our like intra-spinal space that we like, and mark the probe on both ends. And this is what we're supposed to see, all right? So again, the spinous process is here, right, in the intraspinal space, and the dura, right, and this is our subarachnoid or intratracheal space. Here we, like, again, caudal to the conus medullaris, so we can put our probe here, and right, and this is how it will look like a more live image. And after we're gonna do that, so again, we're gonna mark the area that we like, and then we're gonna rotate the probe, mark it again, and we have our target signs, and we can put our probe on the sides and just do the puncture. That's the static approach. If we speak about dynamic approach, again, we're gonna leave our probe, we're just gonna sterilize, of course, everything, we're gonna put like the tegaderm or the sterile sleeve, and then we probably, again, the textbooks speak about doing like the in-line approach. So here in this clip, you can probably look on this area over here, and you will able to see the needle coming down. So again, spinous process, the dura, the intraspinal space, and here is again, the needle is coming down, and probably take some CSF out. The disadvantages of this approach are a few. Like, technically, you can do it as a one person, but like, I'm assuming it's could be quite complicated to hold the probe in one hand, like, and you have a child that maybe is moving, well, you have the nurse maybe to hold it and like poke with your needle in the other hand. So it's better maybe to use two people. If you want to use two people, for one of them to hold the probe and the other one that will do the LP. So again, it's more complicated. Like, usually, like, it's a small kid, like we don't have enough space to work around. So just think about it. And let's speak about the scenario number 2. So let's say we have like a teenager, let's say she's 16, but doesn't look like a day above 50, all right? And she is overweight, and she's on steroids, and she has acne, so she started minocycline, and now she has visual disturbance, so and headaches, and you do ocular point of care, and you see a nice papilledema, and you send her to the MRI, and it's normal, and now it's time for you to prove your thesis that you have like IIH and you need to do an LP, right? So this is more go from the adult literature, all right? So again, we can use, again, the lying position or the sitting position, rather the cubic versus the sitting. We can do it on both positions. For that, again, I'm going to speak in a few slides about what's best, linear probe or the curve. All right. As you can see, probably the body habitus of those kinds of patients usually will mind us to use the curvilinear if you want to see something. And the literature of the adult world speaks about like two approaches, the paramedian versus the midline approach, right? So let's start with the paramedian. Those slides were taken from the Highland website. So as you can see, they recommend for us like to put our transducer like around the midline, slide a little bit to the paramedian to try to see the articular process here, right? That you can see here on the screen. That's like a good thing to start, and then slide down. Let's say we don't really sure where is L4, where is L5. So if we slide down, eventually we're going to hit the sacrum over here. But we look on our screen like that, and then we can say, well, if that's the sacrum, so that's L5 and that's L4, and those are the spaces that we need. And then after we do that, we can mark like the spaces that we want. All right, and then we can rotate the probe to transverse. Again, see, like we said before, like the intraspinal space or the spinous process, if you're on top of it, and then we can slide down a little bit to the space that we want, mark it again, and then we'll have our target sign, and then we can continue. If we will choose our median approach, so they advise us to start like again to palpate the posterior iliac spine at the level of L4, put our transducer like just on the median on the spinous process that's supposed to be L4. That will look like that, all right? And this is the paraspinal muscle. You can appreciate that the anatomy looks a lot different than what we saw like in kids, right? And after we do that, we can change our transducer to the long, mark it again, all right? And we'll see something like that, right? This is the spinous process of L5, L4, and L3. And we can use the zoom, all right? Again, so this is the space that we want to go, eventually to put our needle, and then we can mark it again, create our target sign, and goes from there. So why the heck to do that? All right, so I'm assuming that the potential benefit of like doing LP point of care ultrasound is to try to prevent some failed LP. Why? Because like when we are failing to do LP, like we can differentiate between viral and bacterial. So then like we expose our patient to unnecessary antibiotics because like we give them empiric antibiotics because like we have a bloody tap or failed tap. And then of course we admit them more because we can rule out meningitis. And we have the lack of ability to tailor the right antibiotics for them, so we give them like a more broad spectrum antibiotics. And of course, like if you fail to do LP, so that's increase our discomfort of the patient and complication due to repeated attempts. And maybe if we use like our ultrasound machine to do LP, it will be time saving. So is all those statements, all those theories are evidence-based proved? So we'll try to answer that. So this is some statements from our like the summary of proof of the evidence, the document that was published in 2016 regarding like the pediatric point of care. So of course, like always from the pediatric point of care world, first they're going to speak about the adult and then we're going to speak about pediatrics. But it is some like statements and some proofs from the adult world. So as you can see in adult, there are a few researches that have been done that show that the point of care is highly effective in identifying bony landmarks for LP, even in those who are obese. In one study, they found a success rate in 92% regardless to the BMI. Other randomized control study showed like some success of 95, and it was more likely to success in obese patient with a greater BMI. And another study that was done, again, find that the point of care LP was found to decrease procedure time, number of attempts, traumatic tap rate, pain score during the procedure, and the benefit was more prominent in those with higher BMI. So that's like some evidence in the adult world. We're interested more in the PIDS world. So